In the clinical context, there's a lot of attention paid to the physical symptoms of MS. And thankfully, there is a growing recognition of paying attention to things like cognitive difficulties now. But in terms of mental health, probably we still are lagging behind a little bit in that. It's not just the traditional anxiety and depression we often think about, but loneliness. And even we've done some work in the area of stigma. So people feel like they experience stigma from others. And yeah, that can be a vicious cycle. It can lead people to become more isolated and withdraw from social activities. A lot of people aren't open about the fact, say, that they have mental health challenges in the first place. So making sure people feel comfortable in opening up about that, whether it's an employment context or other, that will make life a lot easier, I would say, for people with MS.
I'm Brett Drummond. You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. Welcome to today's episode, where we're talking about an aspect of MS that affects so many people, yet often doesn't get the attention it deserves: mental health. Depression, anxiety, and other mental health challenges are common in MS, but the conversations around them are still far too limited compared to physical symptoms. In this discussion, we'll explore why mental health needs to be part of every conversation about MS care, what the research is telling us, and how we can better support people living with the condition. At ECTRIMS 2025, I was joined by Rebecca MaGuire, a psychologist from Maynooth University in Ireland, who has a personal passion for researching and understanding mental health in people living with MS, which she will share during this episode. Rebecca, thanks for joining me.
Thank you. Delighted to be here.
So I'm really happy that we've got an episode on mental health in multiple sclerosis. We were talking just before we started recording about how important this topic is and how often it's a little bit too overlooked, and it really shouldn't be. So I'd really like to start with hearing from you, why do you think that we need to place a bigger importance in terms of talking about mental health in MS?
Thank you, absolutely. So I think we really know from the research evidence that people with MS are at risk of a number of mental health difficulties, including anxiety and depression, but many other mental health challenges. So we know it is an issue, and obviously in the clinical context there's a lot of attention paid to the physical symptoms of MS. And thankfully there is a growing recognition of paying attention to things like cognitive difficulties now. But in terms of mental health, probably we still are lagging behind a little bit in that. So there certainly is a need to acknowledge the fact that this is a challenge that does exist for many people with MS, but also we need to start identifying ways to mitigate those challenges.
And in terms of the latest sort of numbers around this, and I know that they can be really variable in terms of what reports suggest, but what does it look like in terms of the rates of depression, the rates of anxiety in people living with MS compared to the general population?
So we know within the general population, obviously, there is always going to be prevalence of depression and anxiety. And in the more general context, there is growing recognition of this at a societal level. Prevalence rates, as you say, it does vary significantly depending on what data that we look at. But what we do know is that people with MS have a significantly increased rate of likelihood of experiencing those symptoms. I mean, I've seen there's been ranges from, it could be as low as 25%, but there's other studies that report 78%. Mm-hmm. So it really depends on how you conceptualise and how you measure the mental health challenges. But certainly what we do know is that there is an increased risk for people with MS.
Yeah. Do we know a lot about why that is? Is it tied to the neuroinflammation that's happening constantly in people with MS? What do we know about the sort of pathophysiology behind this in people living with MS?
So it is difficult really to pin down often the exact cause, because there could be a multitude of factors increasing people's risk of challenges, such whether it is depression or anxiety. Now, we've done a lot of work, say, in the context of anxiety, and obviously my background isn't in physiology. So yes, there could be some biological bases, but more often than not, it's psychosocial factors and contextual factors that may lead to an increase in rates of certainly anxiety, because if you think about MS, often there's a lot of uncertainty with living with a disease like MS, and that can lead to obviously uncertainties regarding predicting what might happen on a daily basis, the extent of the symptom burden, but even looking into the future as well. And then obviously, say, people with increasing levels of disability, they may experience more social isolation, and that can lead to an increased prevalence of loneliness. And like, I think actually that's another important thing to talk about in the context of mental health challenges. So it's not just the traditional anxiety and depression we often think about, but loneliness. And even we've done some work in the area of stigma. So people feel like they experience stigma from others. And yeah, that can be a vicious cycle. It can lead people to become more isolated and withdraw from social activities. So lots of factors can be at play there.
It's definitely a very complex issue where lots of things come into it. I'd love to unpack some of the work that you've done in the area. And again, we were talking a little bit before, a certain personal engagement, I guess, in terms of your work as well. Can you tell us a little bit about the work that you've done in the area and why you find it particularly important?
Yeah, so something I think is important to disclose from a personal perspective is that I also live with MS myself. And really that's the main reason why I'm involved in MS research now. Obviously I was an academic before I got diagnosed, but over the years I began to think, well, maybe I can start making a contribution to this area. And I know there's such an important movement towards patient-public involvement, PPI, in research. So obviously any work that I'm doing and involved in is going to be PPI-led. And also as well, in the early stages of my MS diagnosis, and something which I'll be talking about at the conference, I would have concealed the fact that I was living with MS. I wouldn't have been very open about it. And that's just another issue, I think, that can affect people's mental health with MS. Sometimes it can be a good thing, maybe, if people want to conceal in living with the invisible symptoms. But sometimes that can lead to challenges. Now, obviously, I've changed in my own journey, and I'm a lot more open about that. But I'm also very aware that many people with MS, especially at an early stage of diagnosis, are worried about opening up. They may feel that they may experience stigma or even discrimination from others. Yeah. So, there are a lot of personal reasons that would have guided my decision to get involved in this research. But even being a patient as well, I'm acutely aware of the fact that, say, psychological difficulties or mental health, they're not really questioned or asked about in the clinical context or at least as much compared to the physical symptoms.
Yeah, so obviously coming into it with a very unique perspective, being an academic, then going through diagnosis. At the point of diagnosis, where did you see research sitting in this area? Was there much going on really? Because, it's almost in a way something that's a new concept in terms of research going into this in MS.
So at the point of my diagnosis, I probably wasn't really in the headspace to look at what research has done, the psychological aspect. It was more so when as I started working in the area of psycho-oncology, actually, that I realised, okay, there's a lot of overlap between, say, psycho-oncology and psychological aspects of MS. For example, in an oncology context, people experience often, say, fear of recurrence, fear of cancer recurrence. And I think in the context of MS, people might fear relapses, fear progression, fear what might happen and what are the implications of living with the diagnosis. So there's a lot of great research going on, of course, in this area now. And a little bit like, as we were talking about, and there's been sessions today on cognitive difficulties, there is more and more research taking place in the context of mental health. But there certainly is a piece to be looked at in terms of the supports for people who are newly diagnosed on the one hand, but then, of course, people continuing to live with the condition over their disease trajectory.
Yeah, and in terms of that, what do we know around how mental health changes across that? Because obviously you've got disease progression. Is there correlations between experiences of mental health as the disease progresses? Does it in a similar way to relapses? Do we have peaks and troughs? What does that look like?
There's some evidence to suggest that people who are in the earlier stages of diagnosis or with relapsing remitting MS tend to have greater likelihood of anxiety, or at least we found that in some of our own research. In terms of depression, it's less clear. And again, different studies will find different effects, so it's hard to have a definitive answer on this. But there is some work to suggest that people with more progressive MS are more likely to suffer from depression. So there are, and again, that's just two instances of mental health challenges. In our own work, say on stigma as well, people who are at more progressive stages of MS or who've been living with it for longer are more likely to experience that stigma. But that may be because they can't hide the fact that they have MS, so they may be likely to be discriminated against for whatever reason.
Yep. And how do these play into quality of life? Because I think they do obviously have quite a big impact on quality of life. There was a paper recently that looked at disease acceptance, and being able to accept disease, probably not unsurprisingly, did lead to higher quality of life scores in people living with MS that were included in this study. How does that sort of tie in across all of this spectrum? And I think stigma is a really interesting one to look at in terms of that.
Yeah, no, absolutely. They are all interconnected, aren't they? Mm-hmm. And MS acceptance, I think, is a big one in terms of, living with the disease. That is, I suppose that's an individual factor. There's lots of social factors that we have to consider as well. But certainly, yes, in terms of the quality of life, psychological measures are often used as part of a battery of tests of quality of life, which is important to acknowledge. I think when we think about quality of life, really, the mental and physical health has to come into play. And as I said, there probably has been more focus on in MS on the physical aspects, but the mental health aspects are really important too.
What do we know about the social aspects? You've mentioned a few times that social aspects are really coming into this. What social aspects? I know loneliness was one you mentioned. Social support networks are obviously something that's tied closely to this. What do we know about the key social aspects in terms of if we're trying to maintain a positive mental health state, which is probably a definition of that is not really easy to give in a first place. But if we were trying to do that, what sort of social factors are most playing into that?
Yeah, social support is so important. And actually one of my PhD students, Joan Ayla-Bosom, who's presenting a poster at ACTRIMS on this, has shown that peer support may play an important role in the context of MS as well. Because that can lead not only to, say, informational support, but also emotional support. And ultimately, that may prove mental health outcomes. But even beyond just the context of peer support, a wider social support, whether it's support of employees or colleagues or friends, that can lead to greater feelings, I suppose, of inclusivity and more positive outcomes for people with MS as well. So, yeah, there's lots of social factors. And obviously then at the wider societal level, making sure that there are policies in place to, greater support people with MS and living, the fullest life as they can as possible. So
I think we've clearly established these problems exist, that people living with MS are at a higher risk of, experiencing psychological difficulties. There are obviously social things that can happen to do it. What other sort of interventions have been shown to be effective in terms of trying to reduce the burden that may come with some of these things?
Yeah, so I suppose, as I mentioned, the social supports, which are very important. I think on an individual level, there's a lot of research to suggest that self-efficacy is really important in a number of different outcomes in MS, and including, say, psychological outcomes as well. So developing interventions that can foster a sense of self-efficacy, very important. Obviously, there are the traditional psychological interventions such as CBT, which have shown to be effective, and acceptance commitment therapy. So there's a lot of psychological interventions, of course, that can help. But I suppose it's important to think what factors can be put in place to make sure that, there's sustained benefits over time. So, making sure a person's self-efficacy increase, but also, as you mentioned, the acceptance of MS is very important too. But, there's probably only so much an individual with MS can do themselves. I do think that societal factor and raising even awareness of this as a challenge is important, because even the research which I'll be presenting on tomorrow, a lot of people aren't open about the fact, say, that they have mental health challenges in the first place. So making sure people feel comfortable in opening up about that, whether it's in employment context or other, that will make life a lot easier, I would say, for people with MS.
And I guess the starting point of a lot of these is with healthcare professionals. We need a recognition that these issues exist. We then need ongoing monitoring of how these issues are being resolved, the right interventions in place. How do you currently feel this works? I guess in the healthcare system, do you think enough focus is being placed or enough conversations happening? Are the right questions being asked when people are coming to their appointments? And in an ideal world, moving forward, how would you see this setup working so that people got appropriate healthcare support for their mental health issues after diagnosis and throughout the course of their disease?
Yeah, no, obviously,
It's a big question.
It is a big question, and I was thinking about it as you were asking me something else as well. In terms of the healthcare context, often resources are overstretched, and it's very difficult in a very short consultation with a neurologist, for example, or practitioner, to fit all those questions in. So it's very difficult. How can that be done? I mean, regular assessment, I suppose, of mental health issues is very important, not just a simple how is your mental health. That can be important as well, of course, but developing some batteries of tests in the same way that we're talking about cognitive difficulties as well. So an ongoing monitoring is very important, and probably some triaging process as well. If a person is showing challenges, obviously there's going to be different kind of stepped care approaches depending on their needs. But there are, of course, other maybe community-based interventions that can help. So whether that is setting up a mechanism for peer support or group interventions, so to maybe take the pressure off, say the healthcare professionals in the first instance, because there was time constraints. There are other ways of doing it, but obviously different healthcare systems probably tackle this topic in different ways. So I'm familiar, obviously, the Irish context, which are very overstretched, and there's probably a need for more neuropsychologists and clinical psychologists in hospital settings. Other countries maybe doing better in that respect, but generally, yeah, I think so. It's more professional support, triaging, assessment of baseline, and ongoing, and then peer support, and etc.
And I think you raised a really important point during that in terms of the questions to ask. You can ask, how is your mental health? It's potentially quite difficult for an individual to answer that question because they may not even necessarily be aware that they are experiencing psychological issues at the time. If you were to, obviously we've got a large number of neurologists and healthcare professionals listening to the podcast. If you were to suggest one or two questions that you think would be the best to ask in an appointment to try and assess how a patient may be going, again, a difficult question, what sort of questions would you ask to try and understand what was going on with a person living with MS in terms of their mental health?
See, I'd be probably reluctant to answer that question because my researcher brain now is tapping in, and it's like, well, what does the evidence say? And it probably does differ very much depending on the individual patient. Yep. Perhaps having some facility for them to answer in an anonymous set or a more, less confrontational setting, because I know, say, certainly in Ireland, if somebody says, how are you? The answer is, I'm fine, I'm grand. Yep. So just asking somebody a direct question is difficult. So, some form of assessment, battery of tests is probably the best way to go. But hopefully I'll be able to better answer that question in a few years when we have more research in the area. And that's something certainly that me and my research group are working on.
Definitely. Well, in terms of that then, as sort of the last question, what research are you particularly interested in? What are the things that you're following closely that you're looking forward to, seeing the results of in the next 12 to 24 months? What do you think the biggest changes are going to be in this space?
So I think, again, going back to people with MS and seeing, well, what are their needs for mental health support, ultimately be driven by patient feedback and the family as well. I know we haven't touched on the wider family and the caregiving community as well, but that's also very important to hear their voices. But then really to identify what are the most efficacious supports that can be developed for people with MS and then continuing to trial interventions in that area. So hopefully we will have clearer pathways for newly diagnosed patients and ongoing patients living with the disease over time.
Yep. Look, it's a fascinating discussion. As I said at the start, it's a really important discussion. I want to thank you very much, Rebecca, for joining us today and starting this conversation that I think we need to have much more often about this topic. Thanks for sharing all of your insights and personal experience with this.
Thank you so much.
Thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MS Translate. The ECTRIMS podcast is produced and hosted in collaboration with two key partners, MS Translate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community, and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2025-26 ECTRIMS podcast series is supported by educational grants from Alexion AstraZeneca Rare Diseases, Bristol Myers Squibb, Novartis, Roche, Sanofi, and UCB. Educational grant providers have no input in the podcast content. Do subscribe to the Ectrums podcast on all your favourite podcast channels, including Apple and Spotify. Visit the Ectrums website, ectrums.eu, to learn more about this topic and more, and join the conversations on X, LinkedIn, Facebook, and YouTube.